Hello everyone, my name is Maharlika Diarse. I'm going to be doing inserting an IV, starting an IV, and discontinuing an IV. Alright, before I start, I have my Nightingale scrub tops, appropriate attire, badge, my hair is pulled back, there's nothing on my nails, Miss Smith's arm, the sharps container, IV extension set, saline, IV start kit, and my 22 gauge 1-inch needle. This is my last one, and 2 pairs of gloves. Alright, so I'm going to wash my hands. After I wash my hands, I will put my gloves on, and I will set everything up before I do the IV insertion. So Miss Smith came in for some IV fluids, and so we are going to start her IV. Alrighty, perfect. So now I am going to take all my supplies out, pretend these were closed. So I will put the tourniquet over here. I have a gauze. I have the sterile dressing for the IV. Let's just put it here. Alright, and tape. Alright, have the tape right here. Other tapes. Perfect. Alright, so we put this aside over here. I will now prime my tubing. Extension set out, and my saline, some trash. Alrighty, so we are going to be priming the extension set. Alright, so now I will take this out, and we'll put this, secure this, make sure it is secured. Alright. So now I'm going to unclamp this end, take this out, holding that. So we're going to prime the tubing to make sure that there are no air bubbles. Alright, around like 1 to 2 drops. Perfect. Alright, so now that it is primed, I will now clamp. And I will, alrighty. So this is aside. I will put this aside right here. Alrighty. And my alcohol swab. I'm going to pretend that this is an alcohol swab, the gauze. I already used my other alcohol swab. I don't have any more. Already. Let's just pretend and use this one. So, right, sorry about that. Alcohol swab is here. Alright, Miss Smith, I am going to put the tourniquet on, and make sure that the tourniquet is 4 to 6 inches away from the distal pulse, or where the insertion site is. So I see it. It's right here. Alright, perfect. So now I'm going to put the tourniquet on. And we're going to make sure that it is not too tight. Alright, perfect. Okay. Alrighty. 4 to 6 inches, I see it. And then the distal pulse is right here. And alright, so now I am going to clean. This is my alcohol swab. I am going to clean from opened it. So now I'm going to clean from the center of the insertion site and outward. Center, outward. Alright, perfect. I'm going to throw this away since I'm going to need it for later. I'm going to put it back over here. In the real world, we will not do that. So I see the distal pulse. Alright, perfect. And now I'm going to get my needle. Throw this away. I will be holding it with the bezel up. So 46 inches, and now I will go 1 inch below the insertion site, and I will go at a 30-degree angle. Once I go to a 30-degree angle, I will advance the needle in, and then once I see draw flashback, I will level out, and when I level out, I will advance 1/4 inch in, and once I go 1/4 inch in, we'll go on further. All right, so 1 inch from the insertion side. All right, so now I'm going to take this out, throw this out, sharps container. So I see the distal pulse. All right, 1 inch in, 30-degree angle. Here we go. All right, and I'm going to observe flashback, and I do see flashback. All right, perfect. Once I'm in, I will level out. Perfect. So now, once I am in, I will take the tourniquet out. Perfect. I will now anchor the IV site. So now, now that the catheter is in, now I will draw back and the needle. I will anchor the catheter in, and now I will draw back the needle. Okay, I anchored the since this is my last 22 gauge 1 inch needle, just for the skills video. In the real world, I will push this white button and the needle will go into the plastic container right there. It's hard to redo these, and since it's my last one, I'm going to put it in the sharps container. Alrighty, so now that I am anchoring the catheter, now I will get my prime tubing, take this out. Perfect. Alrighty, so now I will attach 2 ends. Perfect. Now while anchoring it, now I'm going to unclamp, and I will draw back a little bit and make sure that there is blood, and once I see blood, now I will push the saline solution inside slowly. Pushing the saline slowly. I'm still stabilizing the IV, and everything's looking great. Alrighty. So now that I put everything in, now I am going to clamp the extension site. If we don't unclamp that, everything can go wrong. Blood can come back, all that. So now that it is clamped, we are good. So now I will untwist. I'm not sure why it will. Anyways, I'm having a little bit of difficulty. I think I put it into so I will put that aside. Perfect, it is clamped. Now I will throw the saline away. I'm still anchoring the insertion site. So now I am going to place the sterile dressing, and this is my last one as well. So I already initialed and signed and date and everything. So now I will take the backing off. I normally would take that off, and then I will place it onto here and make sure that it is not stuck onto the the tubing, because that will be a problem. So I will put that on right here. Alrighty, perfect. So, and then I will take off all the adhesive. We can put this away as well. So now that it is on there, right? Now I will put this onto the arm as well right here. All right, perfect. So now that it is attached. All right. So I will just get everything and throw it away. All right, Miss Smith, are you okay? All right, perfect. So now I'm going to take off my gloves, throw it away, wash my hands. So I just did the IV start. So now I ordered to discontinue the IV. So I'm going to wash my hands. I came back into the room, washed my hands. Hi, Miss Smith, I'm going to discontinue your IV. All right, perfect. So then now I will wash my hands, put new pair of gloves on. And we have our gauze that is unused. All right, Miss Smith, I am going to discontinue your IV. All right, perfect. So I am going to take out the sterile dressing slowly, making sure that the patient is not hurting. All right, Miss Smith, I'm just taking this out. All right, perfect. All right, it is out. So throw that away. So the IV is right here. All right, perfect. So I'm going to take gauze, put it where the catheter is right here. I'm going to take this out. Miss Smith, I'm going to take out this tubing on your arm. All right, perfect. All right, Miss Smith, I am going to take out the catheter. Ready? It won't hurt. All right, perfect. 1, 2, 3. Oops. All right, it is out. So now I am going to make sure that the catheter, the 1 inch is here and everything is here. All right, so now we are going to put it back into the sharps container. So holding this for 30 seconds, making sure that you won't be bleeding out. So we waited 30 seconds. So I'm going to just check. All right, perfect. So take that out, throw that into the biohazard. So now I will get a new gauze, put it back where the insertion set is, and now I'm going to tape. Alrighty, Miss Smith, perfect. So I just discontinued the IV. All right, now I'm going to take off my gloves and I'm going to wash my hands. Thank you.